morning, Horn Lake High School. Welcome to another episode of Choose a Career. And today we're here with Miss Deborah, right?
Deborah Lennox.
To talk, and she works with Northwest in respiratory therapy. So if students are interested in respiratory therapy, tell us a little bit about the career itself.
Okay. Well, respiratory therapy is one of those exciting professions where you are working with patients who have breathing issues. It could be due to asthma, bronchitis, or even a preemie baby, or someone who has an accident that comes in through the emergency room. Anything that's related to a breathing issue, respiratory therapists come to the rescue.
Okay. If students are interested in this type of career path, what is the education that is required to be a respiratory therapist?
Well, here at Northwest Mississippi Community College, we have a program that requires you to have an associate degree. In order to get into that program, you must have an ACT of 18, anatomy and physiology 1 and 2, with the labs, and college algebra. So when you graduate from the program, you have an associate degree and you can sit for a national board test.
Okay, so again, students, for those of you who may be confused on that, a regular bachelor's degree would be your typical 4-year degree.
Correct.
An associate's degree is going to typically take about 2 years.
2 years. 2 years to complete it. And you would get an associate in applied science.
Okay, and then you have to take a national boards, which is going to be a test that says you've learned all the skills necessary to actually have a license to do this work.
That is correct. And the test is divided up into 2 credentials. One is a CRT, Certified Respiratory Therapist, or an RRT, which is a Registered Respiratory Therapist. So it's a 2-level test. You pass one, you move on to the 2nd level. And that's how you're credentialed.
Okay, and for many students, this is a very affordable path because if they've got, they apply for FAFSA, and then they can go through and get various scholarships for Northwest as well.
That is true. That is true. Most of our students, once they finish all the information they need for their FAFSA, they either can go on a scholarship or get some type of financial aid if they are eligible for it.
Okay, now where all do respiratory therapists end up working? Is this hospitals? Is this outpatient?
Good question. Respiratory therapists work in a variety of settings. It could be in the hospital, it could be in a doctor's office, it could be in home care, patients that need oxygen at home, it could be in sleep labs, it could be in a cath lab. There are so many varieties of levels of care that you can provide to the patient. You can work directly with doctors to do special procedures, and respiratory therapists can only accommodate them, accommodate the doctor. So there's more than just one aspect to respiratory therapy.
Okay, so what I just heard there is there's lots of job opportunities for respiratory therapists.
There is. There's a lot of job opportunities for respiratory therapists, and so you're just not in one mode, but there's several modes that you can operate out of.
And that tends to bode really well for students who are wanting to get good paying jobs in the future. If there's that much need for it, then the demand is going to be high, and you typically have a very good career with this.
That is true. If you've noticed any news clippings that talked about respiratory therapy, there's such a shortage of respiratory therapists, and we are much needed, and you can make a good salary, good life for you.
Okay. Mm-hmm. Now, obviously, the salary is going to be very different depending on what part of the country you live in, because of the cost of living and those costs associated with the cost of living. But typically in this part of the world, let's say Mississippi, Alabama, Louisiana, what could a student potentially expect to make per year in respiratory therapy?
Well, per year, I'm going to give you the hourly rate. It varies. Right now, if you just came out of school and have passed your boards, you can start out making anywhere from about $28 to $32 an hour. Some agencies are paying more because we're still in the pandemic, and a lot of the health facilities are short in respiratory therapists, so they're paying much more. But they want you to have more experience and definitely be in that RRT, the 2nd level of credentialing I was telling you about. But to start off, about $28 to $32 an hour would be a good guess.
Okay, so That's a very good paying job. All right, now you brought several tools here. Tell us about some of the things you brought.
These are some of the basic respiratory therapy modalities that we do. Patients that have asthma, emphysema, they might take a type of inhaler. They might even take this at home, and this is just a chamber that just ensures them receiving more of the medication. Or they can take a type of nebulized treatment. That's a medicine that goes in here, that the treatments open up the lungs so the patient can breathe easier. Or say if there's just a patient that's short of breath, you might have seen this type of apparatus on TV. It's called a binasal cannula. This will supplement the patient's oxygen to help them breathe easier. Or if that's not enough, it's not adequate for the condition that the patient is experiencing, they might go to a mask. So we can go to different levels of therapy to help the patient. We're focused on, of course, patient survival. So if this doesn't work, then respiratory therapists also work with life support systems. So that's a more intense environment. Really having to know exactly the ins and outs of keeping someone alive on a life support. So we also do that.
Students are interested in more information from you guys at Northwest. Who do they need to contact?
They need to contact me. I'm Deborah Lennox. I am the program director. If you go to the school's website, Northwest website, and go under healthcare careers, then our healthcare programs, you can just find respiratory therapy and my name will pop up. You can call me, email me, text me on my cell phone. It's listed. Everything that you need to get in contact with me is available right on the website.
Awesome. Well, thank you, Ms. Deborah, for coming and talking to us today.
Thank you so much. Thank you.